Hi everyone! I recently went to my 4th month update for the eye surgery. All good. I'm still going strong with my 20/20 vision and I couldn't be happier about that. My eyes are in a good condition. I have a very exciting news to share with you guys. During the consultation, I had the chance to interview my surgeon, Dr. Ryu, which is something I'm really trying to process because he's such a good person and he's very busy, but he took his time to have an interview with me that of course it might be useful if you're planning on having or if you're just thinking about having the type of surgery I got, which is lens implantation eye surgery. I think it turned out pretty informative. These are all the questions that I wish I found before because it was very hard for me and I just had to trust the process, which by the way, I should always trust my gut, but you know, if you're planning on coming here for this specific reason, you might really want to feel that it's worth it, right? Anyway, I really hope Dr. Yu's personality shines through the video because he's such a good person and a good doctor and he's so knowledgeable, and I hope that you can get some answer to your questions. And if you decide to get on this journey, I hope this video can be really helpful for you just to get more clarity and making sure that you make the right choice. Thank you, and I will see you soon. Bye. I do have some questions that might be very helpful for everyone who's going to. What level of myopia or astigmatism is suitable for ICL surgery?
Normally, when you have very high myopes, then we recommend the phakic IOL over laser corneal refractive surgery. So high myopes defines as 8 diopter or above.
Mine.
But but sometimes patient who has less than 8 diopter of myopia but has a very thin cornea, has some pathology on their corneal surface, and also some other reasons not to have any corneal refractive surgery. In that cases, we perform ICL within the moderate or even very low myopes. So right now, I don't see any reason we define ICL surgery patients should follow very high myopes. It can be for all the types of myopia, has certain reasons to do the phakic IOL surgery instead of corneal surgery.
Okay, which is very useful for my next question. Because if I am eligible for LASIK or LASEK, can I still choose to have ICL?
Of course.
Okay, even if I have very low myopia.
Yeah, the approval thing is a little bit different from the Europe and also the US and Asia. Fortunately, we can use very low degree of myopia in Asia market. So about 1.5 diopter or above is available. But in US, for example, the patient should have over 3 diopter of myopia to get the ICL ordered for their use. I don't know exactly what the situation is in Europe, but I think it should be in between Asia and US. If it's available, I think it's possible, but you should know the pros and also cons for each surgery. So you have to choose with the very exact consultation from your doctors. You can choose either phakic IOL or corneal-based refractive surgery. Each one has advantages, disadvantages, but you can choose. That's my belief.
What is the most important thing to consider when you perform ICL?
What is the most important factor? The ICL is putting in something in your eyes. So first thing is checking your eye measurement properly. So is there enough space for the ICL? Do you have enough the endothelial cells to cover, or you have any other pathology within your eye to exclude the possibility of the risk after surgery? So checking proper pre-op evaluation is most important thing for the ICL. And second is what I emphasize over time is choosing the proper exact size of ICL. It's very crucial for the ICL surgery. If a doctor chooses too large one, it will interfere with the intraocular pressure, end up with the glaucoma. Opposite way, if you choose a very small one, your ICL will be touching the crystal lens, increase the risk of the cataract. So choosing the proper lens size is very crucial for for eliminating any risk in relations to the ICL surgery.
Thank you. What is ICL made of? Do you need any replacement over time?
So the material of ICL is called collamer. It's the collagen plus polymer. It's new mixture of the material. It is quite different from the contact lenses we use. The contact lens we use is based on silicone or the acrylic. It's quite different material, but it's much more softer and has a different refractive index, so it's much more thinner. So ICL has some advantage over other types of phakic IOL in terms of the material. But right now, we have several very similar types of phakic IOL available in Asia and also Europe, not in the States. Optiflex and also IPCL is very similar in shape with the ICL, but those two lenses are made of the hybrid acrylic lens. It is very similar to the intraocular lens that being used for the cataract surgery for elder patients. So the material itself is very familiar to the surgeons. The other, but relatively is a little bit newer one with the collamer, the ICL, but has a different refractive index. As I said again, it's much more flexible and thinner. So it is more widely accepted in the surgeons and also the refractive market.
What if my vision changes or get worse after surgery?
Yeah.
Like, I know there are possibilities of regression, like myopic regression, but is this a problem if you get ICL?
We cannot call it regression. Usually when you put an ICL inside your eye, there might be a chance of myopic progression over time. So it interferes with your ordinary activities. We need to have some additive correction to correct that residual refractive errors. It can be done in several ways. You can wear very thin glasses whenever needed to be, but also you can change your ICL into new one to get that residual refractive error done. But also you can do corneal refractive surgery over the ICL inserted eye because the change after ICL surgery is very minimal, very low degree. So only a few micrometer ablation is needed for additive surgery. So currently, my choice of first is to get the corneal refractive surgery when you have some changes in your vision. But sometimes you cannot perform the corneal laser surgery because some pathology, especially adrenal degeneration, it cannot perform laser surgery of a cornea. And you have other types of pathology on cornea which might be interfering with the cornea refractive surgery and other issues, then I prefer exchanging ICL surgery to...
It's safer.
Yeah.
Okay. Any side effects or complication of ICL? Like, what is the successful rate of this type of surgery?
As I said, the exact sizing is very crucial. If size is proper, the cataract and also the glaucoma issue will be not being an issue for a long time. But because of the ICL patients being very high myopes before surgery, they always have some risk having some chronic eye disease such as cataract, glaucoma, retina issues, and also macular degeneration when you get older. So that's why we recommend patients to have a yearly based follow to the clinic to check up your eyes, including these endothelial counts, but also other things is safe or not. So checking that things will secure your eyes for a year. So why not doing that?
Yeah.
So yearly base follow visit will be very crucial, but also we go back to the sizing issue. The cataract and the glaucoma is the most common issue that can be related to the ICL surgery and also the endothelial cell decompensation.
And how long is the recovery period for ICL?
As you already experienced, the ICL surgery has some small incision over your cornea. So that day, about the 3 to 4 hours will be a little bit bothering you. After a day, I think it's almost recovered you see very fine and doing almost all the activities that you do before surgery is possible. But the incision itself has to be closed over time, so we eliminate some activities in 2 weeks, right? So that's a little bit of difference between the normal activity and the more deeper normal activities. So in general, next day is the okay day. Yeah.
And can I feel the ICL in my eye? Like, even over time, I know you get used to it, but at first maybe you can see hole. But after time, will you be able to feel it?
Feeling itself is, as you experience, there's no feeling there. It's not like the contact lenses. You cannot feel any foreign body implanted in your eye, so it's not there. But as the visual quality, because it has a hole in the center, you may see holes, but it will be disappeared over time. So we usually say about over 3 to 6 months, because the suppression physiologic change over your brain will take some time. So when some things go into your eyes and it interferes with the very good visual quality, then the brain should cut down that images, but it takes some time. We call it suppression. But suppression takes over time, 3 to 6 months. But after that, almost every patient do not feel any hole seen there.
And then I have my last question.
Okay.
For people who are used to drive, so if you have ICL, you're going to see halos. Like, will these go away over time? Everything is going to be less impactful for the eyes? Because I remember the first month, I had clear halos around the lights. Is it going to go away, like, after a while?
That's what I said in the extension. You can see some halos when you see some light, especially at night, because your pupil get large when you have in very dim light condition. But as your brain get used to what is very comfortable for you, the halo and glare related to the center hole with the ICL will go away. Most of the patients don't feel any, but in very few has a minimal leftover, but it will not interfere with your night driving, night activities. So something is a little bit bothering me, but it's okay. It's okay.
Not to the point.
So that's the
thank you.
You're welcome.
These were all my questions. Thank you for being so patient.
I hope that you enjoy your life without glasses forever. And please do check your eyes at the yearly base to have a very healthy eye over the lifelong.
Thank you.
You're welcome.
Thank you so much.
You're welcome.